My gardening friends have been asking about this, and they're not going to like what I have to say. This is a systematic review and meta analysis recently published in JAMA Pediatrics that looked at if cannabis use in pregnancy is associated with poor neonatal outcomes. We know that the best type of studies are randomized control studies. We will hardly ever do these in pregnancy because it's really unethical thinking about it if you give one group of people cannabis during pregnancy and not the other and seeing what happens. So we have to look at a lot of studies with a lot of participants to see what the general outcomes are. This study looked at 1.7 million patients. And I will say that the results are striking. Use of marijuana in pregnancy was associated with a 52% higher risk of having a preterm delivery prior to 37 weeks, and a 75% higher risk of having a low birth weight. When looking at the mortality, there's a 29% higher risk of infant death associated with the use of marijuana in pregnancy. Now, a lot of these studies did focus on recreational use of marijuana versus medical use. I know a lot of my patients tell me that they need to use marijuana, especially in their first trimester, to help deal with their nausea. My recommendation would be to talk to your OBGYN and think about what safer medical options we have to deal with those concerns. For my prenatal care providers out there, again, we probably could do a better job about screening and educating our patients, especially in the first trimester, about the use of marijuana in pregnancy. I told you they weren't going to like this.